All right, today we're going to learn how to do a combined spinal epidural. The procedure for doing an epidural and a spinal are pretty much very similar. This incorporates pretty much all the steps that we need. First of all, before getting going, make sure you have everything ready that you need. And for doing a CSE with the epidural kit, you need to open up an extra syringe and, of course, your CSE needle. The CSE needle we use here is a 26 gauge Gertie Mark, so it's a pencil point needle that causes fewer headaches than the Quinky type needle. In preparing for the procedure, I like to take my extra tray here and put everything I need next to it or in that tray. So here's my CSE needle, and then I'm going to get the epidural catheter right there at the bottom, and I leave it in the bag so it's protected and sterile. And then I put the connector, and then my 1 cc syringe for testing the catheter, and then I quickly drop lidocaine. For infiltration, when you're not going to test dose, we use the lidocaine with the epinephrine so that there's less bleeding at the infiltration site. And then we draw that up with the big pink needle, 19 gauge, and then put on the 27 gauge needle that comes in the kit. And then I put my epidural needle there. And the final thing I need to get ready for like an epidural is my loss of resistance solutions. Try to always use saline instead of air for your loss of resistance technique. And then there's that. And now you need the dose that you're going to inject in, whether it's for labor or for a C-section. When you're getting your injection, don't reach across your field. Come over to the side. And for filming purposes, we are a little bit over this, and then get your dose. It is better for the person to inject into your syringe rather than have a needle on this and drawing from them. Better to have them inject into your syringe here. So I have my dose all ready now that I'm going to give, and I put a little yellow tag on it to mark it so that it's different from my local infiltration needle. And what I'm going to give for the spinal for the C-section is different than what I would give for the spinal component for like a CSE for labor. For the C-section, of course, we give 1.6 cc's of the hyperbaric bupivacaine, 0.75% or 12 milligrams of hyperbaric bupivacaine plus 10 of fentanyl and 200 mics of morphine. For a CSE for labor, you would give 1 cc of 0.25% bupivacaine, which is 2.5 milligrams of bupivacaine, and 5 mics of sufentanil.